Hello everyone, my name is Fiona Natania Santoso with my last 3 student number IDs are 249. And now we are from small group discussion B10. We will present our student project with the title ADHD Medicine, Potential Side Effects in Kids. And here are our group members, as you can see on the screen. Okay, and this presentation will be divided into 3 chapters. The first one is introduction, and the second one is contents that will be talk more about ADHD, and lastly is a summary. Now we will move into chapter 1 introduction that will be explained by my friend. Thank you.
Hi, my name is Gusti Agung Ayu, Adinda Fidelia Tresna Putri, with my last 3 digits name are 232. So today I will explain about the chapter 1 introduction, which is consist of background, problem identification, purposes, and benefits. So, the background of this topic. Attention Deficit Hyperactivity Disorder, or ADHD, is the most widely diagnosed behavioral disorder in children and adolescents. ADHD is a disorder characterized by attention deficits, hyperactivity, and impulsive behavior. ADHD can interfere with children's development in terms of cognitive, behavior, socialization, and communication. The prevalence of ADHD in school-age children is 8 until 10%, and this makes ADHD one of the most common disorders in childhood. The proper medication can help children with ADHD to focus so they can do their responsibilities, to fidget less, and improve their social skills. It is a prevalent misconception that ADHD treatment with pharmacological therapy will eliminate all symptoms or hyperactivity and impulsive behavior in children with ADHD. Nevertheless, long-term usage of ADHD medication will negatively affect the children. And the purposes of this topic is the first one, to understand the definition of ADHD. The second one, to understand the epidemiology of ADHD. The third one, to understand the factors that cause ADHD. The fourth one, to understand treatment or therapy of ADHD. The fifth one, to understand the types of ADHD medications. The sixth one, to understand the side effects of ADHD medication in kids. And the seventh one, which is the last one, to understand the solutions if there are any side effects of ADHD medication in kids. And lastly, the benefits of this topic. Through this paper, writers and readers will certainly be able to understand and know more about the definition, epidemiology, factors, treatment or therapy, types, side effects, and solution of the excess side effects of ADHD medication in kids. I think that's all about my explanation. Thank you.
My name is Ayu Karralika Raidinjana with the last 3-digit number 246, and I will be explaining about the next part. Definition of ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder with a categorization according to observation of behavioral symptoms. And the defining symptoms of ADHD are split into symptoms of inattention and hyperactivity or impulsivity. ADHD presentation varies as mainly inattentive, mainly hyperactive or impulsive, and merged presentation. And the symptoms need to be there before the age of 12 years for at least 6 months, and those symptoms has to lower social, academic, or occupational functioning. ADHD has also been involved in other cognitive domains like difficulties in regulating a person's psychological state in response to changing environmental circumstances. And that's all I have to say, and the next explanation will be carried by my friend.
Hello, my name is Ketut Gayatri Karuniaputri, with your last digit name 235. Now we're going to be talking about what is actually the epidemiology of ADHD. ADHD has become a case that is often found in children as well as in adults. For children, it occurs from 2 till 3 years old with dominant gender of boys. Also, another factors from environmental as such as consuming alcohol, stress, smoking during pregnancy, toxins, and even genetics has been contributed to ADHD.
Hello everyone, my name is Agung, Istri Anggreni, and my last digit name is 233. Now I will explain about the factors that cause ADHD. The first factor is prematurity. This is the most important factor that can trigger ADHD. A study from the USA proved that some babies born prematurely with a gestational age of 34 to less than 37 weeks are at risk for ADHD. The second one is low birth weight. This is also, of course, driven by several other factors. For example, is mothers who continue to smoke during pregnancy. And the third factor is maternal substance use during pregnancy. Substance consumed by the mother during pregnancy should also be monitored because it can increase the risk of ADHD. The example is pregnant women who use paracetamol, which that will affect the formation of the fetal brain. And the last one is physical and mental condition. This is supported by several studies which have found that mothers who are stressed during pregnancy will have an effect on the fetus they are carrying. That's all that I can say, and for the next explanation will be explained by my friend. Thank you.
Om Swastiastu. Hello, my name is Malkata Pantara with my last digit number is 248, and now I will explain to you the treatment or therapy of ADHD. So the purpose of ADHD therapy is to alleviate symptoms, enhance overall effectiveness, and also remove behavioral barriers. There are two most common types of therapy or treatment of ADHD use, which is behavioral therapies and also pharmacologic treatment. So behavior therapy such as parent training and also classroom management, where parents mentoring and additionally educates them how to apply effective parenting such as praising and also giving consequences. Then there is a pharmacologic treatment such as medicine help most children with the fundamental ADHD symptoms. So medications such as psychostimulant and then antidepressant and a typical antipsychotic and a mood stabilizer are some of the drugs used to treat ADHD. And then there's atomoxetine, noradrenergic system stimulant medication, has a little misuse risk, and then there's agonist of alpha-2 receptor. Thank you.
My name is Chokore Sri Agung and my name is 21025112252. There are two types of ADHD medications. The first one is stimulants. Stimulant is the most common treatment for ADHD. It helps manage ADHD symptoms such as impulsive behavior, hyperactive, and could improve attention span by increasing some particular chemicals, predominantly dopamine, by transmitting signal between nerves. Consuming stimulant does not lead to habit forming, but it might lead to addiction. There are three types of stimulant. The first one short-acting, such as dexedrine and Vocalin. The second one intermediate acting, such as metadate and methylene. And the third one is long-acting, such as Concerta and Vocalin XR. Consuming stimulant can cause side effects: headache, upset stomach, dizziness, increased blood pressure, and dry mouth are some of the common side effects. However, it also could lead to a serious heart or blood vessel problems, visual disturbance, skin rashes, serious allergic symptoms, and initial thoughts, also hallucination. Thank you.
My name is Fricillia Wijaya with the last three-digit name 236, and I will explain non-stimulants as one of the types of ADHD medication. So non-stimulant medication are usually given if symptoms are poorly controlled, if the patient is experiencing contraindication or intolerable side effects of stimulants, or if there is a history of substance abuse. The most commonly used and tolerated non-stimulant used to treat ADHD in children and adolescents include atomoxetine and the alpha-adrenergic receptor agonist clonidine and guanfacine. Non-stimulant therapy is an alternative treatment option for stimulant therapy. Guanfacine sustained release or GXR and atomoxetine ATX are the two non-stimulant drugs approved for use within ADHD in the United States. So that's all, and the next slide will be explained by my friend. Thank you.
Good morning, doctor. So my name is Nga Xhi Wei with the name of 250. So today I'll be presenting part 1 of the side effects of ADHD medication in kids. So medications can be helpful in treating children with ADHD, but then most medications will cause various side effects. And the more rarer side effects in children will include psychosis, which is hallucinations and hearing voices, headaches and nausea, moodiness if the dose is given too high, and including tics, which are quick, sudden, and uncontrollable movements. Thank you.
My name is Ayu Karralika Raidinjana with last digit name 247. Now I will continue the explanation about the side effects of ADHD medication in kids. So actually, effective drugs for ADHD appear to be safe and well tolerated. Most of the adverse events reported in the randomized control trials are mild and transient, such as decreased appetite, could decrease, and impact on sleep. For instance, insomnia for stimulants and somnolence for FO2 agonists are among the most common events. Some medications, such as stimulants like MPH, lead to a more general increase of dopamine in the brain, while ATX increase norepinephrine selectively and dopamine indirectly in the frontal cortex. Adolescence is a vulnerable period, and the expression of ADHD during this period may have destructive effects on the entire life course, resulting in fewer friends, school difficulties, unwanted pregnancy, sexually transmitted disease, abuse of drugs or alcohol, and others. Side effects were associated with negative feelings towards the ADHD medication and less adherence. For instance, high adherence to ADHD medication in school settings has been shown to yield higher academic grades among young people with ADHD. In general, adherence is important in achieving treatment effects. I guess that's all from me. The next explanation will be presented by my friend. Thank you.
Om Swastiastu. Let me introduce myself. My name is Putu Diva Prilana with last digit number 238. So now I will continue the presentations about the solutions of excessive side effects of ADHD medications in kids. So to overcome the side effects of ADHD medications, patients can ask their doctor to prescribe low-dose medications that are age-appropriate, increase the dose of the drug every 1 or 3 weeks until the drug works. But it is still under medical supervision. Here are some side effects of ADHD medications and how to deal with them. First one is headache and dizziness. So follow the drug recommendations given by the therapist or on the drug packaging. The second one is dry mouth. So if you experience dry mouth, it is advisable to rehydrate. Moisten your mouth with a torch. So that's all from me. Thank you.
Hello, my name is Putu Fricillia Wijaya with your last digit name is 241. I will be continuing about the solutions of excess side effect of ADHD medication in kids. The next one is loss of appetite. What you can do is to eat regularly still so that your blood sugar does not drop and you have difficulty concentrating. If you lose your appetite, try eating small but frequent meals. If you continue to lose weight due to irregular diet as a side effect of ADHD medication, consult your doctor. And lastly is nauseous. To prevent and treat nausea caused by side effect of ADHD medication, you can eat food that reduce stomach discomfort. Eating bananas and bread may be an option to reduce nausea after taking ADHD medication. Thank you.
Hello, my name is Putu Chandra and my last 3-digit name are 240. And now I will present you about the summary of this topic. ADHD is a neurodevelopmental disorder with a categorization according to observation of behavioral symptoms. Factors that cause ADHD are prematurity, low birth weight, maternal substance use during pregnancy, mother cycle, and mental condition. There are 2 most common types of therapy or treatment of ADHD use, which is behavioral therapies and pharmacologic treatments. Types of ADHD medication are stimulants and non-stimulants. There are 3 types of stimulant: short-acting, intermediate-acting, and long-acting. To overcome the side effects of ADHD medication, patients can ask their doctor to prescribe low-dose medication that are age-appropriate. Thank you.